Okay, so there are a couple basics that you need to understand before we start this, and then you got this. Okay, so we're gonna talk about osmosis, which is diffusion of water. Okay, for this only, for right in the next like 20 minutes or so that it takes me to go over this, okay? You're gonna take the word tonic and replace it with salt or sugar, because we're made up of salt and sugar. That's it. Okay, how much salt are we made up out of? What percentage are we made out of? 0.9%, because that's normal saline. That's why we give people normal saline, because it's the same saltiness as our blood, right? You bite your lip, you can taste it, right? Because you can taste the salt. Okay, what percentage of sugar are we made up of? I thought you were stopping me. She goes, yeah, I was like, stop. Do you have a question already? Okay, we're made up of 5%. So y'all got something from the video. We're made up of 5% sugar. Okay, what follows salt? Water. What is the predominant electrolyte intravascularly? Sodium. What is the predominant electrolyte intracellularly? Okay, all right, so let's keep all those in mind before we embark on this. Are we ready?
Yes.
All right, so we're going to start with isotonic, because that's like the same, right? It's the same. So these are your cells. So the best way that I can explain this to you is I want you to picture that this right here is like a blood vessel, okay? And I've just got this big old giant cell in my blood vessel. Okay, so when I go and draw their blood, right, to like look for electrolytes and things like that, I'm sticking a needle in right here and I'm pulling out the blood. Do you understand what I'm saying?
Yes.
Okay, so keep that in mind. And then we're going to replace the word tonic with
Salt or sugar.
Okay, so in isotonic, iso means like the same, right? So it's the same saltiness, the same sugariness as we are. Okay, so we've got sodium and water inside the cell, right? You have to have some salt water, yeah?
Yes.
And you've got sodium and water outside the cell, yes?
Yes.
Okay. So when we give an isotonic fluid, that is the same salty, same sugary as our body, right? So if it's the same, we know that in our cells, that water and sodium come in and water and sodium come out and water and like it's very easy for that to do that because it's the same saltiness as our body, right?
Yes.
So an isotonic fluid, okay, it would be the same salt and sugar as our body. So give me an example.
0.9%.
All right, so 0.9% normal saline. That's the same amount of saltiness, right? What else?
Lactated.
Now, what is lactated ringers? Nobody ever told me this in nursing school. When I was like, oh, lactated ringer, but I didn't know what it was. What is it?
I don't know. I heard it in clinical, but I don't know.
Okay, so lactated ringers is the same thing as normal saline, but it has more electrolytes in it, okay? You will not pick lactated ringers in all of nursing school unless the patient has one of two conditions. Number one, birthing, because they're about to lose a lot of electrolytes. There's poop coming out everywhere. There's amniotic fluid and they're peeing everywhere. Like it's very messy, okay? So lactated ringers is for birthing mothers, okay? What's the other patient population we use lactated ringers on? Burn patients, because they're also losing a lot of electrolytes. But other than that, we just use normal saline for our boluses, for our regular fluids, for our maintenance fluids, yada, yada. Do we understand?
Yes.
Okay. So do you understand how isotonic works? It's just like, works just like our body. And then the isotonic solution, 0.9 normal saline, lactated ringers, D5.9, right? Because if a D5.9, 0.9 is the percentage of normal saline, right? D5, what does the D stand for? Dextrose, which is sugar. So that's 5% sugar and 0.9. That's exactly what our body is. Does that make sense?
Yes.
So, in what scenario would you give an isotonic?
All of them.
All of them.
Unless there's like a specific reason why you wouldn't. So if a patient has vomiting, isotonic.
Okay.
They got diarrhea, isotonic. They need a bolus, isotonic.
Okay.
There's very few times really you're going to do either of these. This is kind of where we live and it's the easiest one. Yeah?
Yes.
Okay. All righty then. So now we're going to go to hypotonic fluids. Okay, you'll understand when I write this up here, these are fluids. The loss, well, they'll call it like what kind of loss did you have will always be opposite these. And I'll explain that more in a second. But isotonic is same. So you're going to get, if they have an isotonic loss, meaning they lost the same amount of water as electrolytes, right? Or salt, then you're going to give them isotonic fluids. Okay, that's easy. Do we understand this one?
Yes.
Now we only have two to learn. Okay, so we have sodium and we have water inside the cell, right? And we have sodium, we have water outside the cell, right?
Yes.
Okay, but water follows salt. Okay, so remember I told you, picture this as a blood vessel, right? and I put in an IV catheter right in here. Can y'all picture what I'm saying?
Yes.
Okay. So I'm going to stick an IV catheter right here and I'm going to start infusing fluids. If I do a hypotonic fluid, hypo means low, tonic means salt or sugar. So I need a low salt or low sugar concentration. So that would be anything less than 0.9. So if I gave them 0.45 normal saline, that's less than 9. Yes?
Yes.
If I give them a D2.5 or a D5W, what does the W stand for? Water. So if I gave D5W, even though it's 5%, I've watered it down. So it's going to end up being less than 5. Does that make sense?
Yes.
Okay. So if I'm giving them, if we know hypotonic is mostly made up of water, right? Because it's hypotonic, less salt, less sugar. That means it's more water. So let's just say for shits and giggles, okay, that it is mostly water. So if I put water in here, what is water like? Salt. So it's going to go and find the salt. Yeah. Which is going to go right into the cell, and that cell is going to swell because now it has more water in it. Do you understand?
Yes.
Oh, okay. Okay. So if you're giving them a hypotonic solution, that means you've had what type of loss? Hypertonic loss. Okay. Do we understand that?
Yes.
Yes? No?
Yes.
Okay. So just think in your minds, if they give you a patient scenario and you're like, do they need water? Like, let's say I tell you a patient has a sodium level of 160. What is that patient going to need?
So they're high in salt.
They're high in salt. So they need water because we're made up of salt water. So what type of solution do I want? Give them a hypotonic solution because it's made up of mostly
Water.
Do we understand?
Yes.
Okay. Okay. So now let's go to hypertonic. So hyper means, oh, you happy? Oh, you look happy. Okay. Hyper means increase. Tonic. Now you'll know for any other purposes, tonic means muscle tone. Okay. This is just to remember this. Okay. So high salt or high sugar. Okay. So this would be more salt than 0.9 or more sugar than 5%. So give me some examples of hypertonic solutions. D10, D50, right? Give me some examples of the salt. 3%, normal saline 3%. Does that make sense?
Yes.
That's a hypertonic solution. Lots of salt, lots of sugar. So picture this as a blood vessel, right? Yeah.
Yeah.
Okay. We've got some sodium on here too. Sodium, water, sodium. Okay. So you start an IV cath. I'm giving them shit tons of sodium. What follows sodium? So all that water that was in the cell is going to go outside the cell and shrivel up the cell. Oh, does that make sense?
Yes.
Okay. If you're giving a hypertonic solution, that means you've had what type of loss? A hypotonic loss. Is that easy? Yes. Do we understand it?
Yes.
Okay, cool. And just so y'all know, this is just a quick nursing tip. Anytime there is a concentration of 10% or more dextrose, that has to go in a central line. It's too thick to go through peripheral IV. Okay. Unless you're in an emergency situation, obviously, but you know what I mean. All right. Questions on hypo, iso, hyper, blah, 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 boom. Got it?
I'm good.
Yeah. Awesome. I'm so happy for y'all.